Hello, and welcome back to another episode of To Whom It May Concern. I'm your host, Malak, here with my co-hosts, Mariam, Khuwaila, and Inara.
Hey, Assalamu alaikum.
Hi.
Okay, so I feel like we're kind of in the part of the year winding down. The weather is really cold. We're really exhausted. Our immune systems seem pretty much shot at this point. We decided that in this episode, we were going to discuss some health tips with our Dr. Coco and kind of some tips, I guess, on how to keep our immune systems up and how to weather this weather.
I like the play on words. So let's start off kind of broad. Huela, what does a normal healthy diet look like? Because these days there's so many diets that promote like the keto diet or the paleo diet where they just remove a whole food group. So can you just tell us what we're supposed to be doing?
So as you mentioned, there are a bunch of diets out there and people can pick and choose whichever they feel most comfortable with. In general, it's best to have a balanced diet. So that would include just a mixture of fruits, vegetables, grains, dairy, your protein. There's actually the food pyramid that they taught us in school. Mm-hmm. They now change it to My Plate, where it kind of just has like the different proportions of how much you should eat of each of those categories. They are doing different studies now that see which diet is better than the other. I think it also depends on where you are. If you're overweight versus underweight versus normal weight, and if you have the intention of wanting to lose weight. I think the main thing overall is that people should have a sense of how much they should eat because it's become such a social thing. Like food is very social to us. So we overconsume calories that we don't need to have. And actually one thing that I learned in med school is the one thing that has proven to prolong longevity or like increase your life is eating less, like about 70% of the recommended daily value.
70%?
70% of what's recommended, not of what we actually eat.
For example,
so like if you
like 70% of 1,500 calories or something.
Yeah, so like whatever recommended calorie intake for your height and weight and stuff. Eating less than that has actually proven to increase your life. And then they've also done other studies that show that people who do not eat any meat, any protein at all, I guess have healthier outcomes and don't have as many like heart attacks or things like that. But I don't know how well those studies are.
So avoid keto because keto is mainly
keto is the complete opposite.
Like
it's all carbs and all, or no carbs and all protein.
Mm-hmm. Well, I was gonna say, Khuwaila, from a medical perspective, do you advise people to do the keto? Like, is that amongst doctors? Is that like a thing?
I think it depends on where you are. Like, if a patient is overweight, has a lot of other things that comes with it that can worsen your health in general. More likely to get diabetes, more likely to have high blood pressure, more likely to have complications from that. It would be better to do whatever diet that you can lose weight. If keto diet works for you, then go for it. But in general, I think if you are at a healthy weight, for me personally, I think just eating less and like kind of proportioning well would be the best diet to have.
Okay, so I'm a really big chocolate fan. Like, I need to eat a candy bar every single day. Is that okay? Should I be concerned? Should I avoid these chocolate cakes and cupcakes?
So, again, that's when it comes to having proportions. So, dark chocolate is actually considered healthy.
Well, I like milk chocolate.
A healthier option. I know.
Filled with caramel.
So, that's when it's like you kind of should pick and choose what you want to eat. So, like, maybe instead of having your processed Hershey's chocolate every day, maybe make it every other day, or not have that entire slice of cake, a smaller slice of cake. And then mix it in with healthier options like maybe dark chocolate every once in a while instead.
I want to go back to that point that you mentioned that I found really interesting because I feel like a culprit of it is social eating. Like every time you hang out, whether it's in the house, like a movie night, or going out to eat, or going out for coffee, like it always has to be going out, and then food is involved in whatever the plan is. Even if we go out to an activity, like we're like, oh, let's go to Topgolf, and then there we'll eat the wings that are there or whatever it is. So that's very fascinating.
It is. It's
I never thought
definitely a social thing.
Yeah. And even in general, I feel like whenever somebody like rides with me, I'm like, do you want to like? Are you hungry? Do you want me to pick you up some food? Like automatically, let me take care of you.
Want coffee?
Yeah. And there's like cultures like the Arab culture, the Latino culture, where it's like you want to feed your guests, or you want to feed your children, and you want to make sure that they're like nice and plump, so that that's how they are when quote unquote healthy.
Yeah, and when somebody's over though, you want to be hospitable, so that's a way to show that you're hospitality, like I'm taking
Not
care of
cheap.
you. Yeah.
No, it's not about. Well, that's when it says like proportioning, and then like just switching your options. Like
I was gonna say maybe just go for something healthier.
yeah, like
than all
fruits,
the cakes and stuff.
Yeah, fruit, grains, like, and a lot of times when we do offer food to our guests, a lot of them are healthy, and then it's just like some non-healthy ones.
How about coffee?
Black coffee is good. Black.
I heard it helps with cardiovascular.
It increases your metabolism, and it does have some other health benefits. It's only the black coffee that's
I was gonna say
like
the stuff we drink
the
from
way I
Starbucks.
drink coffee. Honestly, I try not to drink coffee unless I'm really, really tired, because the way I drink it is with a lot of cream. And it's like the sugary type cream, so it has like the sugar and cream in it, like the flavored types. And that is I put so much of it that it's really unhealthy, so I try just not to drink coffee at all.
Like sometimes when I go through like Dunkin' and Starbucks, I'm like, I like it really sweet. Make sure you sweeten it up for me.
Yeah, see, no, that's not good.
How about
Added sugar is not good.
It's funny because coffee doesn't even work for me. Like, coffee doesn't make me awake, but it puts me in the mental state to be productive.
Yeah.
So, like, I'm going to go study now, so I need to get my coffee and place it on the table so it feels like I'm studying.
it's the ambiance?
Yeah.
I mean, I could see that. That's probably why half the people started on coffee, and then they're paying $7 so they just drink it.
Yeah, I mean, it looks good and then it tastes good.
I had a quick question too. How about exercising? How much exercising should we be doing?
So the American College of Cardiology actually recommends that you have about 75 minutes to 150 minutes of exercise a week. And you can like break that up into however you want. So if it's like 20 minutes a day, a half hour every other day, whatever you like. I think
75 minutes one day out of the week.
No. Well, it's in general, it's better to do small things consistently than one thing at one time.
You know when you like don't do your homework until the Sunday before school and you just spend like 10. That's Inara, 75 minutes up and down the block.
Yeah, done. I think the important part is just to make sure that you're doing some activity that increases your heart rate.
And it's really important that we remember to be active, because I feel like a lot of people have the same problem like me, where my life is just like sitting. Like, while I'm studying, what am I doing? I'm studying sitting down. At work, you're on the computer. So it doesn't promote an active lifestyle. And you have to kind of like get up and remind yourself, oh, I haven't moved for the past like hour and a half. Go walk around the block or something.
Yeah, people have like those watches that that remind them, or that have like different activities like on the watch to encourage them to get up and walk around a little bit.
Yeah, my Apple Watch ping when it's like it's time to stand up.
Yeah.
Or like
Are
take
you
a deep
still
breath.
alive?
Others have like
You've been sitting for way too long.
some people have like these pets where it's like if they walk this much, then they like feed them or this or that. Like it's weird stuff that they have on their
Like
their
apps
watches.
and stuff.
I don't know if it's apps or if it just comes with a watch. I don't know which watch it is.
Some people compete with like friends, so you're able to see your other friend and how much they've walked. So it's kind of like require you to do like, oh no, I'm gonna win. I'm gonna get up and walk.
Challenge, yeah.
I used to do that, and I would be so competitive that we would go like 20,000 steps.
Really?
And at one point, I would just be walking around my table just to get those numbers up.
Hey, good for you. We have that actually for our residency program. I am not winning though.
Ooh, wait.
It's funny because you always see those memes. I don't know if you guys have ever saw it, but it's like when you're trying to get 8 hours of sleep and exercise every day and have a social life and be successful and have clear skin and it's like in a day,
just have that perfect
everyone
life.
relates. But that actually brings us to our next question, Coco. Why do we always feel so tired? And what are ways that can kind of help us with that?
So that's a multifactorial thing. There's too many things. No, we have a lot going on. Main thing is we're not sleeping well. And then on top of that, we're stressed out. So emotionally we're drained. And then we're not eating well. And then on top of that, we're not exercising because we don't have the time. So a lot of people like will have all of these issues, and then a combination of that is what likely is what's causing a lot of us to be very, very fatigued, very drained throughout our life.
So I know this is going to sound like a silly question, but how important is sleep? Like actually biologically speaking.
Yeah, because I think, undervalue how important sleep is.
Sleep is, it's extremely important. It's literally our entire body and our mind just kind of resetting. And it's funny because even after, like, let's say we study for something really for a long time, and then when we go to sleep, it kind of just like erases whatever we don't need and kind of just helps us remember the stuff we do. And the way one of our teachers kind of explained it is, you know how like let's say you're basketball, you're practicing your shot and you kind of like are trying to figure out what's the best way. And it kind of just erases the ways that you don't, the forms that are bad for you to not make that shot, and then you just fixate on how you do it well. So that's how it kind of is. So it's like you're memorizing this thing and you kind of won't have it legit memorized and stuck in your brain until you go to sleep, and then it solidifies it in your brain.
I think my brain has it wrong. I memorize all the song lyrics, but my test questions, I have no idea. After I sleep and wake up,
really?
It's gone.
Well,
my body clearly didn't think that was important.
But you don't sleep well in general.
I was gonna say Mariam has the amongst us all, Mariam has the worst sleep schedule hands down.
And here's the thing, it's also not, so it's how long you sleep and also when you sleep. People that sleep just as much time, but like let's say they're working night shift versus day shift, like there's still their entire circadian rhythm or their sleep cycle is just very messed up. It's also like just trying not to stay up all night studying or doing whatever you need to do, working.
So first, make sure that we try to sleep early and
get enough hours.
Eat healthy, exercise before you like check off being anemic or
hypothyroidism.
Yeah.
I mean, those are also very common causes of, especially as females, very common causes of being tired. Yeah, I would definitely try to fix that, or like try to fix that as much as possible. And then if that's not working, go to your doctor and then get that blood work done.
I would also say like a common thing that we do now is before we go to sleep, we're on our phones. So I feel like that kind of activates our mind and gets our brains thinking before we sleep, and that probably affects the quality of our sleep.
Definitely. There's the sleep hygiene that we're supposed to be practicing, and for people that are having a really difficult time sleeping, they should follow it. You don't exercise 2 hours before going to sleep. You don't want to eat or drink any coffee before going to sleep either. And then you want to stay away from your phone about a half hour before you go to sleep. And then you also want to leave like your bedroom just for sleep. Like you shouldn't be reading, you shouldn't be working there. You should just make it a place for you to relax and sleep.
And I think making your room dark, right? That's supposed to also
you need to dim the lights. And that's why phones and like electronics aren't good, because they're usually pretty bright screens that kind of just wake us up.
I know Juela has sent me this list more than one time.
Yeah.
Mariam, take a hint. She's just gonna start putting sleeping pills.
I mean
just some melatonin.
Yeah, some people do that.
Something that really helped me actually sleep was finding okay, so I re-listened to the same lecture over and over again. One that has like a really boring monotone voice. And my body knows that the second he starts speaking, I go to sleep. And it's the same lecture,
That's
so it's
like,
great.
Yeah, that's how I used to be in class. Even now, if I listen to a lecture, it's like...
No, in class, when the teacher dimmed the light for the PowerPoint presentation, you knew I was gone. I was like, come on.
Yeah. It's like I'd be... and then you wake up right after lecture's over. It's like crazy.
No, I'm saying I record my teacher's voice during lecture so that I can fall asleep to it later on at night.
That's smart.
He has benefited me greatly.
Honestly, it's their fault for making those chairs so comfortable.
Yeah, right?
Look, it's a lecture hall of 300 people. I know you're not looking at me. The lights are low. Like, what do you want
I
to
can
happen?
easily, like, lean back on the chair.
No, I'm
It's
rude.
like-
I fall asleep in the front row.
Why do you sit in the front row?
I pretend that it's going to make me have some sort of shame and I won't fall asleep. But it's not true. It's not true.
We slightly mentioned melatonin and how individuals take that to help them go to sleep. So my question is, should we be taking vitamins? Is it effective? Is it important? A lot of people emphasize it. Get your vitamins, get your newer vitamins.
Your daily vitamins.
I wouldn't call melatonin a vitamin. I would just say, like, that's kind of a hormone that helps us, like, prepare to sleep. So it is natural. But vitamins in general, you technically do not need vitamins if you are not deficient in that vitamin, for the most part. So, like, if I have enough vitamin A, I don't need more. If I have enough vitamin D, I don't need more. Because the body will just either get rid of it or continue to store it, and if you're taking too much, you can overdose on it. But that typically doesn't happen unless you're unless you take the entire bottle at once.
What are some common deficiencies women have?
So especially like hijabi women, vitamin D deficiency.
I don't think I've ever met a hijabi that's not vitamin D deficient.
I mean,
'Cause do
well,
we
no,
absorb stuff through our hair? Like, I don't get it.
no,
in
it's
our
through your skin.
Oh.
It's the sun hitting your skin, and then it
And we
transforms.
absorb it?
Yeah, it transforms like cholesterol into vitamin D. It goes through that whole process. But that's how our body makes vitamin D, and then we also like can eat it through our diet. But another common one is iron. Iron deficiency is very common, especially with women, because we lose a lot of it when we get our periods. So that can cause anemia and can also be a reason to cause fatigue.
So what are some tips you think we should implement into our daily lives to keep from getting sick? Because I know everybody around me now is starting to feel congested, and you just feel the germs in the air.
So, I mean, with the weather change now, it's hard. Like, this is the time where everyone is getting sick. But in general, sleeping and a good diet
Washing your hands.
Yeah. No, sleeping and a good diet is a good thing to keep your immune system boosted. And then, hand hygiene. I mean, I wouldn't go too crazy into, like,
Too much hand sanitizer and stuff?
and like I wouldn't go too crazy and like sanitizing everything around you, because that in itself has its own issues. But yeah, just washing your hands, especially before you eat. If someone's sick, I'm not saying you need to stay away from them, but like not touching what they touch or eating after them, like that.
Yeah.
Like common sense stuff.
Yeah, and if you're sick, like sneeze in your elbow, like
or
things of that nature.
elbow tissue. Like, yeah, when people sneeze in their hands, I find it so gross.
How about that whole vitamin C spiel?
The emergency stuff.
Yeah. Or just
So
yeah.
I honestly don't know the science behind it. I guess.
Okay.
I guess like the vitamin C boosts your immune system, but like there aren't really studies, at least that I know of, to see if it works. But personally, this is all like anecdotal. Personally, I love that stuff. Anytime I feel like my throat's starting to hurt, or I feel a little sick, I'll just like take it like one pack a few days in a row, and I feel like
you find it effective.
yeah, like
Oh,
I feel like it either prevents me from getting sick, or if I do get sick, it's not as bad as it was before.
Really? I feel like it doesn't help.
Really?
I know a lot of people that do take it. I mean, I don't I think I've tried it like once. I don't really remember how it helped, how it affected me. But I do. A lot of people are on it.
Yeah.
Like, especially
Yeah.
when the season starts, they don't wait to get sick. They just kind of knock back a bottle every day or something.
Yeah, you can take like I have the
Yeah.
emergency bee with like this
You mix
packet.
it.
You mix it with water.
Yeah.
Here's the thing. So like I usually take it anytime I feel like I'm gonna get sick. You know how like you have that
Like itchy
feeling.
throat.
So one time we ran out and I didn't take it and I got sick so bad. Like again, this is all
Like,
like
it hit
I
you
don't
harder.
Oh my god, it was such a bad. It was really really bad. Again, I don't know if this is like has anything
Placebo.
to do or if it's just a coincidence. You know, who knows? But I like it.
What's your opinion on intense antibiotic pill pushers?
Oh,
Like people
my
that are
God.
always taking antibiotics.
That is literally going to it's causing issues now, and it's going to cause more issues in the future. You should not be taking antibiotics for a cold. Cold is caused by a virus. Virus is not a bacteria. Virus is not a bacteria, so it will not be killed by the antibiotics.
Also, do not take pills given to you by family members.
Yeah, we do
Like,
that
go to a
so many
doctor.
times.
Get checked up, get the antibiotics from there.
Yeah, like we give each other pills like, oh, and here's the thing. If you are prescribed antibiotics, you should finish that course. You shouldn't have extra pills.
No,
Like to
people
give
be
to
like,
someone
"Oh,
else.
I'm done. I finished. Here's my 5
Like, oh,
extra.
I took 2 days,
Kuwaita's
but now
literally exposing every out of family.
yeah, like, and our family does it all the time. It's so bad. Like, oh, I took 2 days of it, and now I'm gonna pass it to you because now you're sick. It's like, no,
And I'm
that's
feeling better.
Yeah. Like literally family group chat. Hey, I'm having ear infection. Anybody have some?
Z-Pack?
no, I have no. It's so bad because it's just creating.
Well, we keep telling Quita to prescribe us stuff, but she doesn't.
Get
we
outta
have to
here.
get it from each other.
No, because
What's
it
in
just,
your cabinet?
it creates more resistant organisms that will be harder to treat. If you keep taking antibiotics, you're gonna like wipe out all the quote unquote weak bacteria, and only the very resistant bacteria will grow.
I remember when I was working as a farm tech, and it was, there's a lot of Arab. It's a very Arab dense area, and not just Arab. It's just a lot of patients in general, and because it's an urgent care, and I swear to God, between like October and February, we were passing out Z-Packs like candy. People would come in for prescriptions for Z-Packs. We would get so many orders. I think we would probably give out like 3 times as much as the rest of the year to 5 times as much. Like, we were stacked on Z-Packs. It was insane.
And I'm sure they're mostly like people with colds that do not need the Z-Pack.
Yeah, I mean, if their doctors are prescribing it too, I guess, because they don't want to hear the patients complain.
Yeah, do you
so they're
think
kind of
people
just like-
bully doctors into giving them medication?
Some people do. Like there are doctors that'll just kind of want to please the patient.
Mm-hmm.
So they'll just give them what they want, because patients get mad like, "Oh, I went to the doctor and they did nothing. They just told me to like take some Tylenol and ibuprofen, then I'll be fine."
So you just say the fancy name
Mucinex.
for it? What's the fancy name
No.
for Tylenol? I will prescribe you some
Acetaminophen.
acetaminophen.
They don't know what that is.
Giving you Tylenol.
They're like, wow.
No, or like, yeah, or the over-the-counter stuff. Like, you're just gonna treat the symptoms. Like, if you're congested, take Mucinex. Like, and they're not happy with that. They want to go feeling like they got something from the doctor, even though they probably don't need it.
I swear, one of the best things you can do when you have a cold is that Vicks menthol rub.
Oh my God, yeah.
That stuff is the move when you're feeling congestion or when you feel like you're going to get a cold. I swear to God, it's the best thing you can do for yourself.
And tea and mint.
Or the Yensun and Baboonage.
No Yensun, tea and mint only. So I have a question about this, Huayla.
Okay.
Every year I get the flu shot. And every year I get sick of the flu right after I get my flu shot. Why do I keep going to get my flu shot still? Like, why do I keep getting sick?
So, the flu shot is a live virus that we give to, or they give to us, because I get the flu shot too, in order for us to kind of boost / prepare our immune system. So, if we were to get the flu, then we're ready for it.
So pretty much it's giving you a little sick,
Yeah, so
saving
that
you from being a lot of sick.
exactly. And that's the point of vaccines in general. It's supposed to boost your immune system. Like, it shows a little bit of the virus or the bacteria so that your body can recognize it, so that when an actual infection comes, it's able to mount a better response.
Do you recommend people take the flu shot?
Yeah, I mean, I feel like I'm in healthcare, so I have to recommend it. In general, if you are in healthcare, you definitely should be. Or if like you're around people that are going to be sick, you should, because you're more likely to get it. I'll be honest, before I went into medicine, like when I was younger, I never really got it, but I was lucky enough to never get the flu. What?
That's not fair. I get the flu every year.
Yeah.
You keep getting the shot.
I know. This is a conspiracy. Conspiracy.
No, here's the thing.
2.0.
I feel like it's more important for like younger and older patients, because those are the ones that are a lot weaker and don't have as much of an much immunity. Because like if someone really young or someone really old gets sick, when they get sick, they get really, really sick, where it can be more dangerous. And like, I mean, there are people that die from the flu every year.
I want to share some of my medium sick wisdom with you all. Because I get the flu every year, this is my number one trick to stop throwing up. Okay? Everybody listen. Whether you're a female or a male,
I'm so nervous.
buy Prego Pops. Okay? Whether you're pregnant or not. It stops nausea and vomiting instantly.
Oh my God.
And you don't understand how revolutionary this has been.
Go to Babies R Us.
Whether
Yeah,
you're
I'm
yourself
serious.
or
It's so
male.
funny because every time I go to Baby R Us, they think I'm like pregnant. They
You
think
know,
I'm a couple of months
congratulations.
pregnant. Yeah, and they're like, "Oh, how
You know
many
this-
months along are you?" I'm like, 4. Just give me my Prego Pop so I can go home.
You know they sell popsicles for like children that stop nausea without having.
I don't know. I didn't try those. I tried the Prego Pops, and they work, and they taste pretty good.
What is in there?
I think it's made out of ginger primarily.
I
I don't question
I'm
these
trying to look
things.
it up now.
They literally sell regular ones for children too, but not all Walgreens carry them. Only some Walgreens carry it.
But yeah,
And it's
a
the
lot
same
of
thing.
people-
It's like anti-nausea.
Yeah, a lot of people swear by those Prego Pops.
I do. I'm a believer. It helps. I'm telling you. And I didn't think so. The first time someone suggested it to me, I thought they were so silly. I was like, how dare you? But then now I'm an addict. Every time I get the flu, I run to Baby R Us right away.
Okay, Dr. Coco. So as women, every month we experience this thing called a period.
Yes.
And for most of us, we get really bad menstrual cramps. My question is, what can we do to help remove them, to get through the pain?
So, the reason that we get the pain is because our uterus is actually contracting to get the uterus lining kind of out. And the cramp itself and the inflammation is what causes the pain. So
So can you do sit-ups to help, like, strengthen that muscle?
Well, it's your uterus. It's not your abs.
I don't know. Can you do some sort of exercise?
No. Well, exercise in general, and this isn't just exercise when you're on your period. Exercise in general should help with cramps. I don't know if that's true or not, because when I used to exercise all the time and I used to have the worst cramps ever.
Mm-hmm.
But another thing is a lot of people will take like ibuprofen and pain meds during, like, when they start cramping and when they get their period. But it would be better if they actually take those meds about 5 days before they get their period, because that would decrease the inflammation that's kind of brewing inside. And then it'll help when they actually get their period.
So would we take it like once a day before you get your period?
Yeah, you can just do that. And then honestly, cramps, whatever, over the counter, like there's Tylenol, there's ibuprofen, there's what's the period one specific?
Midol.
Yeah, Midol is pretty good. Midol is actually a mixture of Tylenol and a diuretic. So the diuretic kind of helps with the bloating that we get.
Is it normal to get diarrhea during your period?
Oh, yeah. Most people do, actually. And that's like a mixture of things. It's one, you get the hormones that are like causing your uterus to cramp, but it also goes to other parts of your body, including your colon. And then another thing is that your uterus is like right by your rectum. Mm-hmm. So the inflammation and like the cramping of the uterus is gonna irritate the rectum and cause you to go to the bathroom more.
Why?
Well, yes, we need to learn our biology and anatomy.
Okay, so from a medical perspective, is PMS real? And I'm talking about the whole like mood swings and
and getting upset or sad and you don't know
emotions
why.
are everywhere. And what does that do to?
So it's actually part of the DSM. It's, I think, officially called PMDD, premenstrual dysphoric disorder, or the basic PMS that we know. It's definitely real. Most women will talk about how they have these like feelings that either usually it's like they're happy or sad, or
I've never heard somebody that says
not
they're
happy. I'm sorry. They're usually
I'm like, can I get that period, please?
I will take.
They're usually like sad or depressed or just angry and they don't know why. I mean, I've had that, not every period, but it happens pretty often.
I'm a crier. Like, I'll cry when something happy is happening. I'll cry when something sad's happening. Cry when I'm angry. Cry when I'm laughing. Like, I will just cry. I'm cry happy.
Mariam, you cry all the time.
Crying. Exactly.
It's
so
worse.
Imagine turning it up by 10. I'm telling you, one time I was eating, right? And my dad was with me. And then I was crying because I was so hungry while I was eating. And my dad's like, you're crazy. Like, I don't know what to do with you now because I gave you food and you're still crying. And I'm like, because I'm still hungry.
She needed a few minutes for her stomach to tell her brain
to catch up.
No, but I mean, it makes sense because when you're on your period, it's kind of like that withdrawal of all the hormones that you were increasing. And then it's like all of a sudden you don't have the hormones. So you have all these changes.
So everyone out there doubting the validity of PMS, it's a real thing. So
People are doubting it.
Just, when people are like,
No, I think they just say that, women are crazy.
yeah, or it's not, it can't be that bad. Oh, it's bad.
You know what bothers me? When you are not on your period and you're just angry at something because they did something wrong, and they'll ask you, are you on your period? No, I'm not on my period.
No, I mean, at that point, maybe because, like, you can't really tell. Like, maybe they acted, like, maybe you got upset faster than normally, so they're like, oh, maybe, like that I could see.
Yeah.
But I know some people just say it as a joke. Like,
Or they'll just say it to belittle what you think or feel.
yeah.
But I do find myself getting, like, more angry over stupid stuff. And it's like, I'm getting my period.
Really? I'm like happy, and then randomly this like sudden sadness. I'm just like, where did this come from? Like, everything is going fine. Yeah.
She's doing the happiest thing ever.
Yeah, and I'm just like, why? It's really random.
All normal, ladies. All normal.
All these things are really good to know. Paralleling that conversation, how about birth control? Like pros, cons.
Are there more pros than cons?
So I guess it depends on why you're taking it. Obviously, birth control is the main reason why some people might take it. But there's also other benefits to it, such as people that have irregular periods. What the birth control does is it kind of takes your system out of the way, and then it gives you the hormones, and then when it just regulates your period based off the medication you're taking. Another thing is that people that have acne can take birth control so that it helps them with their acne, with their bacne. Of course, with any medication, though, there are side effects. So depending on what that patient is and what their like medical history is, it could be harmful. A main side effect is that it could cause blood clots.
Ooh.
Yeah. And the blood clot, let's say it starts out in the leg, it could end up in the lung, become like a pulmonary embolism, and it could be dangerous.
We're just
You went for the most serious.
Yeah, because
So it's like take with precaution, obviously.
Side
Like,
effects, death.
ask your doctor. It should be a prescribed medication.
Maybe we should
like-
speak that up.
it is a prescribed. Side effects include. Side effects
Pulmonary
include
embolism.
death. Pee. No, but like if a young girl were to go into the ER complaining of leg pain or even chest pain and shortness of breath, the first thing we think of is she on birth control 1?
Oh,
And then
wow.
could this be like a PE? I think that would be like one of the major ones that we'd counsel against. Usually, I mean, there's so many people on birth control and it doesn't happen that often.
So is this a myth? A lot of people are concerned about this. Some people will be on birth control for 3 years trying to not get pregnant, and they're afraid that if once they get off, that it's actually going to increase their infertility or they won't be able to get it pregnant because of being on birth control for so long.
They've actually done some studies about that. What it showed was that, so when you stop taking the pill, it'll take a few months, I think average, or it was up to 90 days, so about 3 months before you kind of get your regular period back. And then once you get back onto your regular period, they said, like the study showed that the rates were similar to the general population. So people that took birth control, once they got their regular period back, then their rates were the same as people who did not take it.
So they were just as fertile when they went back onto the regular cycle.
It just took some time because, again, you're giving yourself the hormone. So now that you're taking away that hormone, your body has to go back to regulating itself. So it'll take some time for it to do that. But there are other forms of birth control. It's not just the pills. They have a bunch of other things now. It's pretty cool. And then there's other stuff that do technically have hormones, but it's not as much as the pill, so it won't have the effects of causing the blood clots that I was talking about earlier.
Okay, and I think wrapping up this whole health questionnaire with Dr. Coco would be water. How important is hydration?
Oh
I'm
my
so
God.
bad at drinking water.
So many people are. We are made up of mostly water. It's very, very important. And a lot of people don't realize it's good for the way you feel. If people have headaches, if they just drink water, it'll go away. Their skin is dry or like it doesn't feel as radiant because they're probably not drinking enough water. And I know it's like difficult. People are busy. They're always on the go. But I would recommend don't use the plastic water bottles. Use like the reusable ones that you can fill up. And just kind of keep that with you. That's what I do. And ever since I started doing that, I keep a normal like fluid intake since then.
I think it's also we find ourselves more dehydrated is because we're consuming so many other liquids like coffee, like the caffeine, and if we're already not taking in as much water as we should be, that even plays at a greater detriment to the body.
Yeah, caffeine is a diuretic, so it actually gets rid of fluid after you finish drinking it.
But what's the recommended amount of water we should be drinking?
So I guess it just depends. It depends on your size, your height, your weight. I think the generic answer is like 8 cups a day. Honestly, you can I feel like you should just go based off how you feel. Like if you're feeling thirsty, you probably need more water. Unless you have some medical conditions where you just don't feel that, like you feel like you need to consistently drink water, then that's another issue that you should get worked up. But for the most part, if you don't have any issues or you're pretty healthy.
So your minimum should be like 64 fluid ounces at least.
Mm-hmm.
Okay.
I really like the cup that has those like benchmarks on it. So it's like by 10 a.m. you should be here. By 1
Oh,
you
they have
should
times?
be here. Yeah.
I didn't know
and
that.
it makes me feel like I'm like completing a task. When
Yeah.
I finish my water.
How much water have you guys drank today?
I was literally saying I drink 2 water bottles, which I think it's like 32 fluid ounces. And for me, that's like a lot of water in a day. I can go a day without drinking more than a cup
That's
of
so
water.
bad.
Yeah, I'm
I
dehydrated.
only drink 1 water bottle, and it's like 8:45 p.m. right now. But it's because when I'm really busy, like I had a busy day. When I'm busy, food is out of the picture. And
But
drinks.
like food takes more time. Water, just have something right by your desk.
I had this water bottle all day with me, and I just finished it.
That's crazy.
Like this is me carrying my water right in front of my face,
Oh, no.
and I didn't finish it.
How about
I do good with water.
Good. Me too.
The thing
It's because
is,
I like ice.
like
Oh.
Kawela mentioned earlier when she was saying like headaches, I'm that type of person that'll get a headache from probably not having enough water.
Yeah.
And then I'll be like, oh, maybe I should drink some water. And
Do
then
you not feel
but
thirsty?
You know, sometimes I'll feel thirsty and I'll drink a whole bottle of water, but other times I don't. I'm just not. It just doesn't faze me at all.
Yeah, I probably drink 4 cups a day.
I will have a cup or a water bottle by me and just consistently refill it. As soon as I'm done, I'll refill it and just drink it back up again throughout the entire day.
And it's not a matter of me not having like those cute water bottles and stuff. I swear, if you open our cabinet at home, we have at least 15 reusable water bottles.
The issue is it's in the cabinet, not in your hand.
I used to put it on the kitchen table so I would not forget to grab it. I swear. That's it. That's what I'm going to do when I go home tonight. Everybody take out the reusable water bottle, put it in front of your face so
You
in
have
the
to put
morning
it on our
you fill
Instagram story.
Yeah.
Oh, gosh.
We should do a water
Now I'm
challenge.
held accountable.
I know, we should do a water challenge.
Yeah, don't be using that plastic stuff.
Okay.
We need to be environmentally conscious as well, guys.
Save the turtles.
And the planet.
The fish.
It's important for everyone to realize that our body is interconnected. So when one thing is imbalanced, it'll affect a bunch of other things. So that's why it's important to kind of try and figure out a way to balance every aspect of your life. So sleeping healthy, eating well, exercising, making sure your mental health and your stress level is minimal. So kind of balancing it out for all aspects to make sure that you are having an overall healthy, balanced life. And I know this seems like, oh, we've heard this a million times, but it's just to stress on how important these simple tasks are. And yet I know they are simple, and it might be
They sound simple, but they're
they
very
sound
hard
simple,
to do.
but exactly. They're difficult for us to incorporate it until we actually start incorporating it. So once it becomes part of our life, part of our day, then it becomes like, oh, it really was simple. Like, oh, I can just have a water bottle and drink it throughout the day. Oh, I can just make sure that I'm exercising at this time of the day or whenever. It becomes a lot more simpler once you actually prioritize it and fit it into your schedule and start to actually do it. It's also important to realize that sometimes you do need to see an expert or like get some other advice. So if you need to go see a doctor, it's important to establish a primary care doctor just in case anything were to happen or if you need any advice on if anything is going wrong. Trust me, we do not bite. We
Sometimes.
we sometimes
We give shots.
that's not a bite, but that is only to help you. So yeah, just finding a primary care doctor. You don't have to go see them that often. Just maybe go see them once, kind of establish care, and then whenever you need to at that point.
If everything, like if you feel fine and you feel healthy, should you still do like a yearly blood test?
I don't think so. You probably don't need to do it every year unless something comes up, especially when you're young and healthy.
And your physical state does also affect your mental state as well. So
And
like
vice
when
versa.
you're feeling good and you're feeling healthy, yeah, your mental state will reflect that. And if
Yeah, and vice versa. If your mental state is good, it'll also reflect physically.
Okay, well, thank you, Dr. Falaneh, for answering some of our common questions. If you guys do have any more questions that you'd like her to answer, share her expertise, you could go ahead and DM us. But thank you so much to everyone for tuning in and listening to this week's episode of To Whom It May Concern. Please subscribe, like, and follow us on social media. We appreciate and love all the support we've been receiving so far. If you don't already follow us, you can find us on Instagram, Facebook, and Twitter at The Modern Skeptics. That's also where you could DM us or ask us any of the questions you may have. If you have any new topic ideas you want us to discuss, we're always looking for new things to talk about, so please feel free to send us a message. If you have any ideas you'd like us to discuss and you don't happen to be on social media, please feel free to email us at modernskeptics@gmail.com. Sincerely, The Modern Skeptic. P.S. The greatest wealth is health.